Hi, my name is Alexander Levine, and I'm speaking on behalf of the Bronx One Policy Group, made up of several of my classmates at the Albert Einstein College of Medicine in the Bronx, New York. Thank you for the opportunity to participate in the Diversity in Medicine Conference 2022. Today, we will present a novel model for community engagement and health policy advocacy through efforts that have led to securing federal government funding to transform the Cross Bronx Expressway through the federal infrastructure bill. The Bronx One Policy Group's primary aim is to investigate one policy issue in the Bronx annually and to use our host institution, Montefiore and Einstein's platform, to advocate for and present policy solutions to local government. We believe that as the largest employer in the Bronx and as a healthcare system, we have the potential for and a responsibility to create positive socioeconomic impact in our borough. Bronx One Policy Group functions through three major work streams. The Healthy Bronx platform focuses on podcasts and social media engagement, community outreach with CBOs, and policy ideation. We have partnered with Congressman Richie Torres' office and State Assemblywoman Karina Reyes. Our podcast, with a diverse range of guests, is partnered with the Department of Health's Bronx Borough office. We decided early on we wanted to focus on health policy connected to transit and infrastructure, leading us to spend much of fall 2020 trying to understand what policies had the strongest community support. Throughout our close work with numerous community partners, some of whom are listed here, we identified a diverse range of infrastructure and transit-related proposals, from increasing access to public transportation to improving pedestrian safety. And as we highlight in the rest of our presentation, our work with community leaders and local representatives led us instinctively and organically to our primary focus during the 2021 school year and beyond, capping the Cross Bronx Expressway. Bridging community-based organizations, academic medicine, and public health research with policymakers has driven this project from its onset has been a cornerstone of its success. Pictured on the left is our primary community partner, Nilka Martel, founder of Loving the Bronx, a CBO that organizes around social and environmental issues through the use of parks, open space, and waterways throughout the Bronx. We introduced Peter Munich, professor of public health at Columbia University and author of the 2018 American Journal of Public Health paper seen here, with Nilka at Loving the Bronx, into the general landscape of local Bronx policymakers. As you'll see, this paper has been a critical tool for grassroots advocacy with federal policymakers. In partnership with the journalists at a local Bronx paper, the Hunts Point Express, we produced this podcast episode. The narrative in this episode describes how Nilka's experience of having an asthmatic son led her to environmental advocacy throughout our borough and working tirelessly to cap a portion of the Cross Bronx Expressway. The episode also highlights how the paper written by Peter Munich et al. Was an instrumental advocacy tool for Nilka and her team. Our individual relationships with policymakers are stronger together. Richie Torres has helped lead the charge nationally, and Karina Reyes, State Assemblywoman, has advocated at the state level. From the onset of this project, we have seen all of our efforts as part of a design project. We have tried to incorporate design and photography into all elements of our advocacy. Meticulous attention to aesthetics helps improve dissemination of our materials and message. This is evident in our 2021 annual report entitled The Bronx is Building. This 40-page booklet outlines the argument to transform the Cross Bronx Expressway through focusing on health, urban planning, and environmental racism. A PDF is available at bronxpolicy.org. In terms of outcomes and where this project stands today, the infrastructure bill was passed on November 5th, 2021. It contains a Reconnecting Communities Fund, which will be the first ever program to reconnect communities divided by transportation infrastructure. Up to $2 million from the grant will be used as a feasibility study to determine what can be done to transform the Cross Bronx Expressway. Foundations to design solutions to transform the highway will grow from a studio course between Columbia's Public Health and Architecture graduate schools, which Dr. Munich, referenced earlier, helped to co-teach. Design renderings from this course are featured in an exhibition that we curated. The announcement is seen here, now on display within our hospitals. Connecting with news outlets has been instrumental to raising awareness to transform the CBE. From working with a journalist at a Bronx local paper, this article shown here was written in parallel with our podcast episode, to writing an op-ed on a widely read New York City platform, to now gaining increasing national and international coverage. In fact, I was interviewed for this story in The Guardian. Our work has been shared widely with influential policymakers. Chuck Schumer, Alexandria Ocasio-Cortez, Congressman Torres, Bill de Blasio all have copies of our Bronx is Building manuscript. Renderings shown here of a future of the Cross Bronx are now on display within our hospital system. Visit Healthy Bronx on Instagram, link below, to play the video rendering embedded on this slide. Thank you to the DIM conference and our partners helping to make this work possible. We are excited to be here and look forward to speaking with everyone on the conference day. Thank you.